All right, so for cupping for neck restriction, there's going to be two primary spots we're looking at. We're going to be looking at this upper trap muscle here, which is basically on any of us, it's the most upper portion of muscle bulk you can feel. And then this levator scap muscle, which if you find your shoulder blade, which is kind of shaped like a triangle here, you come to this upper inner border of the triangle, and you're going to want to be trying to find somewhere in through there. So you want to use some sort of professional massage cream or coconut oil or something that's going to reduce the friction between the cup and the skin, more for comfort than anything. We're going to take our cup, apply it on the upper trap, and then whatever mechanism you use to produce the suction, you might have to play around with cup sizes on the muscle, but you're just basically trying to induce that suction up into the cup. Some cups will have these number readers on them, and you can go basically try to find the moderate amount, which is halfway up. And then I also am looking at coloring of the skin. You want to see that nice pink turn of a color. If it's turning purple or extremely dark right off the bat, you have too much suction there. So we're going to apply one on the upper trap, one on the levator in that upper corner. Okay? And you really have, from here, you have two options or three options. You can just let them sit on there, what we call parked, and do what they're going to do for 30 seconds, a minute, 2 minutes. Or you can have the option of, depending on what body part, you can go through a passive movement, so you can have something or somebody else take the head or take the body part through a passive movement. In this situation, it doesn't necessarily work because Steve is upright and supporting his own head. And then the third progression, or the highest progression, is to go through an active movement while the cups are on this spot. And typically what I'm going to recommend is just going through the movement that was most limiting or challenging for you. So with Steve, if we said left rotation is challenging, I'm going to have these cups stay right where they are, but I'm going to have Steve take left rotation. And keep in mind, when you move and you change the tension of the muscle, the cups are potentially going to do that where they pop off, and that's okay. You can keep going with what you have, or you can reapply and try not to go so far into the range. And then you can also add the tuck of the chin to the collarbone to take it a little bit farther. Again, we could also add a cup over here to get this right side lengthened out as well. It's really up to you in terms of how you want to apply the cups and then retest. But these are the main spots we're going to get to improve neck range of motion in this test. Good.